In tonight's Woman's Doctor, you're pregnant, but you find out your baby is breech, and that means the baby's head is facing up rather than down. But could the baby correct its position on its own before delivery? 11 News' Lacey Griffiths gets the facts.
So you've learned your baby is breech. That could mean you'll need to deliver by C-section, but not always. I spoke with Mercy Medical Center Dr. Janna Mudd.
Do you usually see breech babies come at a certain point in pregnancy?
They can be breached any point during the pregnancy, and the earlier in the pregnancy the baby is, the more likely they are to be breached. When we start worrying about it or thinking about it a little bit more is towards the end of the pregnancy.
Dr. Mudd says there are different types of breech positions. Frank breech is when babies' feet are straight up by their head. There's also complete breech, when baby's head is up with both knees bent. And there's incomplete breech, which is head up with one leg bent. Moms sometimes try little things to see if baby will move.
Things that moms tend to do can be like position changes. Sometimes moms will try to go on their hands and knees, or try to lay on the floor with their back and then put their buttocks up on a couch or something to see if they can get the baby to flip. Sometimes moms will put something cold on the top of their belly and something warm down below, but really nothing's been proven to really help that much, or we need more data to support that.
In Dr. Mudd's practice, they might do an ultrasound at 35 or 36 weeks to see if baby is breech. If so, they can perform a procedure to manually flip the baby.
It sounds very painful.
Most patients tolerate it pretty well. The success rate's on average about 60%.
If it doesn't work, a C-section will likely be ordered, but Dr. Mudd says babies can flip on their own all the way up to the last seconds. Lacey Griffith, WBAL, TV 11 News.
Lacey, thank you. Breech babies are usually monitored for things like hip dysplasia or a twisting of the neck after birth.